Hi, Kalindi.
Hi, Anna.
We're going to talk a little bit about Free's Beyond Health programming this year. Can you tell us a little bit about the theme and why now and why is FRI the place to do this kind of work?
Sure. So, as we know, health has become a term that's very value laden. There's good health, there's bad health, and we assign cultural and economic value to both individual health and community health. So, we use the word to mean many different things. For example, an individual might get medical tests that fall into the so-called normal range, and so this is considered healthy. But then those ranges were not designed for the many women and underrepresented people who have been excluded from the medical research behind them. So, do we even know exactly what will be healthy for them? We also talk in popular conversation about healthy work life balance or the health and wellness industry, and here health is a commodity. So, meanwhile, one in two people in the US have chronic illness, and women and Black, Indigenous, and people of color are overrepresented in that 50%. So, Beyond Health starts the process of bringing these many meanings to the surface so we can address them and address them specifically to make progress talking across fields because health is obviously an urgent issue. It indicates diminished life and even premature death for communities that have been excluded from care. And they've been excluded by structures of racism, sexism, ableism, nationalism, also the prison industrial complex and transphobia, among others. So we prepared this theme well before the pandemic because health was already a crisis issue in the US. And Free's uniquely positioned to bring together researchers across disciplines and practitioners across fields through a common political commitment to do the work of sorting through the complexity of what we mean when we say health. And they want to do this so we can get at this politically urgent question of what needs to be done to address the nested health crises facing the US right now. So let me ask you a question. Can you tell us what the programming looks like this year for the Beyond Health theme?
Sure. Yeah, the Beyond Health programming is run as a collaboratory of scholars and practitioners. The foundation of the collaboratory is Free's visiting scholars who will participate all year long and help really shape the trajectory of the conversation. And then each session, we invite UC Davis faculty and graduate students whose work intersects with the theme. So there's a nice balance between having the dedicated presence of the visiting scholars throughout the year, and then the rotating participants from campus that help generate energy and introduce fresh perspectives. Each collaboratory is organized around a keyword that gives the session focus. And we actually just wrapped up a session on the keyword care that was run as a roundtable style conversation inspired by the work of several of our visiting scholars. And it was a really great example of what the collaboratory is really designed to do, involving humanists, social scientists, as well as faculty from the School of Nursing and Internal Medicine. So, Kalindi, you're also one of the participants in the collaboratory. So, can you tell us a little bit about how your work intersects with the theme?
Sure. I actually feel like this theme is related to all the work I've done in my career in different ways. So I'm going to be really quick and just give a few small examples. So one is I'm part of a group of authors called the Precarity Lab, and we just published a book called Techno Precarious in November. And one of the chapters in the book is about how most of us in the US have a generally insecure relationship to healthcare. And one way we talk about this is in the automation of Medicare and Medicaid, which has even further reduced people's access to insurance coverage. And even if you have private insurance, you might be abruptly denied coverage for a prescription or an office visit after the fact, and there's no recourse. So we also talk about how human doctors and nurses who've trained their whole lives or their whole careers to protect human life and address suffering are fighting to get to patients just as hard as we are fighting to get to them for care. So it's obviously a broken system. And I'm also working on a monograph about autoimmunity and the work that patients are having to do to get care because the history of medical research has excluded their communities and life conditions. And a third project is part of a book by a 6-author collective, which includes one of Free's visiting scholars, Chris Hansman. And that one is called The Science We Are For, a feminist pocket guide. And it offers social justice tools for health science practitioners, but also scientists in general. So you are also in the collaboratory because your research is in this area. So tell us about your investment in the theme.
Sure. Yeah, I'm interested in the possibilities and limitations of understanding aspects of embodied experience as specifically health concerns. Most of my work in this area has been around the idea of sexual health. How and why has sexual health become legible within the language of health, or sexual life, rather? And part of this is looking at the emergence of the idea of sexual dysfunction, of course, but it's also understanding how the sexual is wrapped up in a larger drive to maximize and optimize bodily capacities. How we frame issues largely determines how then expertise in that domain is understood. And sexual health is one of those areas in which there are some really interesting productive tensions around who is an expert, how expertise is generated and circulated. So part of why the interdisciplinary collaboratory structure of this programming is so helpful for my thinking is because I want to be in conversation with urologists, with psychotherapists, with pop culture experts, with people adept at thinking through how sexual representation serves a pedagogical function. So I want to be in that room, even if it's a virtual one, with all those people at the same time.
That's a great explanation of the value of the collaboratory. So, what should people look out for coming from Free in relation to the theme this year?
Yeah, look out for report outs from the collaboratory keywords, including reading lists for those that want to dive into these issues and explore with us, as well as video content that we hope will bring more people into the conversation. Maybe even a spring event and maybe even a publication. So stay tuned. Thanks, Kalindi.
Thank you.